morning, good afternoon, good evening, wherever you might be. Thank you all for participating in this webinar today to learn more about RDI's activities. In particular, a new and exciting project that we're about to embark on, which is the development and implementation of a collaborative global network of centers of excellence for rare diseases. As most of you are representatives of member organizations of RDI, I think you all know me by now after 5 years. I'm Paloma Tejada, Director of RDI, and it is my pleasure to introduce you to our panelists today. So here we have Matt Boltz-Johnson. He's the project lead, and he's the brain behind this project. He has been working for the past 7 years at Eurordis on European reference networks. And before, he was at the NHS England, where he developed 17 clinical networks for ultra-rare diseases, connecting more than 50 hospitals at the national level. So Matt is keen to add an international layer to his already extensive experience developing clinical networks at national and European level. Matt, thank you for being with us today here. Louise Clement, you might want to say hi to everyone. Hello. And Faria Bacchus, they work at Health Standards Organization, HSO Accreditation Canada. They will be working as part of the project team once it is officially launched. Louise is a doctor and has extensive experience in assessing and accreditation health organizations. Louise and Matt worked together in the ERN assessment framework before, and they have been already thinking a lot about what the function and the role of this global network should be based on the MOU that RDI signed with the WHO and that Jan will tell you all about in a few minutes. You can also see on your screen Shlaulani Macabella. She's RDI's new engagement and outreach manager. She's the first point of contact for all of you RDI members and will tell you more about the next steps following this webinar. And then last but not least, of course, is Jan Lecam. Jan is the Chief Executive Officer of Eurordis. He's also a member of the Council of RDI. You all know Jan as a leader of the rare disease patient community. I think Jan needs no further introduction. We all know him, and he will tell us more about the project's background and the vision also. Behind this project. So that will be the first part of the webinar. Then the second part, Matt will outline the concept model for the WHO Collaborative Global Network for Rare Diseases. And he and Louise can answer some questions at that time relevant to the concept model. And then the third part of the webinar will be Matt describing the project in more detail and the governance of the project. And again, you will have a chance to ask broader questions at the end. So there we are. We're ready now, I think, to talk about part one. Jan,
thank you very much. Yours. Thank you very much, Paloma, for this introduction. And hello to everyone. It's really, I'm thrilled to be with you for this webinar. It's really exciting. It's like, it's coming after 2 years of efforts and months of thinking. So I'm really excited. And you all know how important in what we're doing is the work with WHO, and what we will discuss today is what may become the flagship for WHO on rare diseases among the other activities that we will develop with them or that they might develop by themselves. But also what we're discussing, I think, is one of the areas where RDI is starting to translate a vision into transformative, concrete project, concrete services. And what we're going to talk today are a lot of words, concepts, but I trust that this concept will translate into something very concrete for patients in the coming years. So to start with, WHO and rare disease. So you remember that the first step was to have the WHO Director General, the new one elected, to do a statement on rare diseases in February 2018. After that, we have advocated for a year and a half on universal health coverage to have rare diseases included into the UN political declaration, and that came true in September 2019. In parallel, we were working with WHO to develop what could be a multi-annual collaboration. And we have a very long document, which we have discussed in previous meetings with you as members of RDI. But the important point was that we signed a memorandum of understanding between WHO and RDI in December 2019. So please note that September 2019, December 2019, that's yesterday. And in the middle, there has been the COVID crisis, which has sheltered all at home in the last 2 months. And believe it or not, still the project has kept its momentum and it's progressing. And this is what we will present this morning. Next. So in the memorandum of understanding between WHO and RDI, there are specific objectives for the year 2020. And the main and most important one is this project. So WHO and RDI will collaborate to improve the organization of healthcare services by proposing to establish a global network of multidiscipline, specialized expert centers for rare diseases. Why am I reading that? Because I want you to see the language which we have already put into this agreement with WHO, because concept IDs, in the sense of IDs, and language in the term of words, vocabularies used, are things which have been discussed for months with WHO. So they already carry a meaning with them. So a global network of multidiscipline specialized expert centers for rare diseases in a structured approach, and you will hear that a lot, grouping rare diseases by therapeutic area. So here already you have 3 clear IDs, and I'm adding the 4th, not the least. So to be inclusive of all rare diseases, to leave no one behind. And this is at the core of the concept being proposed here, which may be very different to what you have been exposed until now, which is different than centers of expertise for a specific disease or for certain rare disease only. WHO and RDI will prepare a need assessment study so to propose the conceptual and methodological framework for the network. So what we will be, so that you see exactly where we're going with this webinar and with the activities, is that we are not yet creating this network. No, we're coming with an ID and a process to discuss the ID in order to shape it with you, with the stakeholders, so that progressively it becomes something which is really meaningful and embedded to the reality, local reality, to be changed. So that's the need assessment study in order to propose a conceptual and methodological framework, which we will do by the end of this year to WHO in November, December, and at the end of next year in 2 steps that will be presented to you in a moment. And part of the effort is to have a bottom-up approach. So it has to go from the reality of the field to promote the identification and support of highly specialized multidisciplinary centers. So identification here, we all have a role to play to identify them. Support that goes back to public funders, which becomes part of the concept and of the project, in order to connect these centers of expertise at the regional and international level. And here we need to have your vision also. Next. Thank you. So the vision is that what is already called WHO Collaborative Global Network for Rare Diseases, and WHO has networks in other areas, but they have already discussed internally that they may go, if we have the right concept in place, toward a WHO Collaborative Global Network for rare diseases in order to connect the major academic healthcare organization. So when you will hear hubs in this webinar, we mean a hospital, which is associated with a medical university and which has research capacities. So an academic healthcare organization with multidisciplinary rare disease specialist capacities. So some capacities, may not be all initially, for the regional and at the global level. What we want to do with this initiative is to improve access to universal health coverage. So that's the positioning, the vision of the project, is that we're contributing for WHO to improve access to universal health coverage and to strengthen the healthcare system within the current available resources. That's very important language. We may have a very big red nose when we say that, a Pinocchio nose, but we pretend that this is going to be with current existing resources because our concept is so good that it will help to reshuffle how we use the money and make it much more efficient. Certainly there will be some more expenses down the road, but we can't tell for now. So within the SDG agenda of 2030, the ambition is to make the global network potentially available, we say, to serve 2 billion of people out of 7.5, meaning with the current epidemiology knowledge, potentially 85 million people living with a rare disease benefiting from it. To expedite and provide accurate diagnosis, that's really the starting point, the entry point, because that's the journey of any patients in the odyssey for diagnosis, but to reduce the time to diagnosis and misdiagnosed, and also address the diagnostic odyssey in less than 1 year after the first contact. It's a vision again, that's what we want to promote. So 1 year after the first contact with a medical doctor to have access to an accurate diagnosis. And this is where this network has a role to play in cascade in the healthcare system, as it will be explained to you in a moment. To break down the traditional barriers in accessing care, which are often experienced by patients and families around the world, through an open, direct, and self-referral to the network, as much as through potential healthcare pathways. So we have this vision that these hubs are forming a network around the world, sharing functions and activities, but also each of them locally have a role to play in shaping national healthcare pathway. So they're going to be kind of lighthouses for rare diseases in your country or in your region. And all that into a vision of an access to holistic, affordable, and quality, highly specialized healthcare. Now we will listen 3 minutes of a video from the director at WHO in charge of universal healthcare and
health systems.
And healthcare systems. Yeah, and healthcare systems. Sorry, it's mentioned health promotion, but it's healthcare system and universal healthcare coverage. He made that intervention in the context of a project of developing scenarios for 2030, 2040, but he's focusing, you will see, particularly on what he sees as important in the next 10 years from the perspective of WHO in rare diseases.
Thanks, Jan. So all good plans and everything. So I'd like to continue with the presentation really. And I think one of the key messages which Rudika Kresch said was when he thinks about 2030 in 10 years time, what would be seen for him as a big success, a big step forward. And he goes into detail of that video, about 2 minutes of it, explaining it is about a global network for rare diseases. And that would be something which would really help and move us all forward in terms of universal healthcare coverage. I want to just outline really a bit about the concept of what this is. And really our starting point when we talk about rare diseases as a global public health need, we talk about it has a unique set of needs which is common across. In each of the continents, in each of the different countries around the world, the needs can be met in different ways, but we all have a common set of challenges which we're trying to resolve, and that's why a global network is really important. Because of the low prevalence of rare diseases, we have people scattered all over, not near hospitals sometimes or health organizations, but we have a big number of people who are affected. So whilst individually the communities are small, together we have a critical mass. Because of the unique needs of rare diseases, the multi-system needs, they're progressive, disabling, and having limited access to hospitals and effective care and treatments available, it can lead to poor outcomes. So really, having a global network will be trying to resolve some of those issues. making the lack of visibility, which is currently there in lots of countries for who the experts are, making that more visible so we know who the experts are and we can access them sooner rather than later. So I wanted to ask Concha to start with a poll and ask you really from your perspective what your biggest needs are. Concha, could you get the poll up, please?
Yes, the question is, for your rare disease and your country, what is the biggest area of unmet needs? That's a multiple choice. So if you think there's more than one need, feel free to highlight it here. The possible answers are: 1, lack of a structured healthcare system; 2, lack of official recognition of rare disease; 3, no expert center for rare diseases; 4, not knowing where to find the experts; 5, barriers to accessing expertise due to funding; 6, nearest expert center is abroad; 7, high cost of treatment; 8, clinical research is fragmented; and 9, lack of innovation. So we wait for all of you to respond. We have so far 50% of participation. So let's give our participants a few more minutes or seconds. By the way, I take this chance to remind you that the link of the video is already in the chat box. Matt sent it to you at 2:18 p.m. So you can find it there. Okay, we have almost everyone that had participated. So I give you a few more seconds before ending the poll. Okay, so that's us. Let me share the results with you. So as you can see, there's a clear winner, which is number 7, high cost of treatment, but there are a few more, so I let Matt to comment on this.
So this is really interesting. Whilst rare diseases, the needs of rare diseases can be quite similar, and we have a core set of needs which make it a global health challenge. Actually, depending on our starting point, depending on where we are around the world, our needs can be different because of the barriers which are there to access care. So seeing high cost of treatments is overwhelmingly the biggest one. So when we think about a global network, should we be focusing that more on the treatments which are becoming available and increasing access to them? There's real variation here in terms of lack of recognition within the country of rare diseases. I know in Bulgaria, I think they only have in the legislation something like 67 rare diseases officially. So there's only healthcare services available for those named ones in the legislation. So maybe what this says to us is that there's real variation across the globe, and we need to consider that where each of your communities are and what your needs are to be able to shape what this vision which Jan outlined is. I think it's really interesting here about funding due to barriers around funding and also not really knowing where the experts are. So increased visibility of experts seems to be a really good thing to push a global network to do, and to increase political endorsement and recognition of rare diseases within a country would also sound like a good win. We're going to capture these in and take this forward in the work which we do, but it's a great starting point. Thank you. So I think it's an important message is, whilst we have a vision of what a global network is, actually how will that benefit me and my rare disease and for me in my country? We have, everyone I speak to with this, they come with questions, more questions. I think the key thing is we don't have the answers, but this project over the next 12 months to 2 years is working with you to ensure that this vision, when we breathe life into to it. It's there and it meets your needs ultimately. So your input into this project is absolutely central. And everything I'm presenting today is just an outline, is just ideas, and you can shape it. So the key bit, I'm just going to talk about the main components of what a global network is for us at the moment. We're thinking about a global network which connects global rare disease hubs, which Jan explained a bit about earlier. But we're thinking about that in the WHO way, that they organize the world in their heads by 6 WHO regions. So we want to engage with the communities in those regions to understand the different needs from the different parts of the world and how your different health systems are, to be able to connect them into something which is global. It will be one global rare disease network. Not like the ERNs, which is 24, it will be one global network. And that will connect these rare disease hubs. When we talk about a global network, who could be members? At the moment, we've outlined that obviously the health organizations will be members. They could be full members or an affiliated member, depending on their level of competency and what their area of interests are. But we think it's also important that patient representatives have a critical role and to contribute to a global network for rare diseases. And I'll talk a bit about that in a more detail. And as I said, the network will be one network which connects hospitals around the world and patient organizations. So I'm going to, I had a really good talk with Doreen the other week, and she was saying to me, you know, let's have some concrete examples so we can say, yes, that works for us. No, it doesn't. So I'm being really brave. I'm going to talk about Canada. I'm sure we've got Louise as well on. I'm sure they'll correct me if I get this right or wrong. But let's say in Canada, they have very good hospitals, a good healthcare system. And let's say we name at the moment Sick Kids in Toronto as an example of a hospital which could be a potential global rare disease hub, one which is active in a global way. We think that recognition of that hospital on a national basis, the endorsement of that hospital to join a global network, is an important political thing to do, which would have value at a national level. At the moment, with the needs which we identified initially, it said that actually that political acknowledgement of rare diseases and of recognizing who the expert centers are in your countries is a really important thing. So we think that that endorsement process is going to be really critical. And we don't think it should be endorsement of, you know, the Ministry of Health. We think it should be a shared endorsement, one which is done by the leading research institute of funders and the leading patient organizations as well. So we build the political support and partnerships around rare diseases, endorsing a hub. We also think that the hubs should have a national coverage and be able to, as Jan said in the WHO MOU, we want to ensure that what's being positioned is that that hub has a role nationally to build the competencies of the health system in terms of rare diseases. So we think that national profile is really important. We do think a global hub probably should cover the majority of the rare diseases, you know, the 390 which are the more prevalent rare diseases, because I think they should be covered within a hospital's specialty departments. But we think that hub then, that Toronto Sick Kids, should have national endorsement and then be assessed to be able to join this global network. We've come up with some ideas around what that assessment might be, but we think what's important is, because of the multi-system needs of rare diseases, that care coordination is an important one. That we don't just look at a specialty level, but we see that the holistic needs of people are met. We want to look through the lens of a person with lived experience to really identify how the hospitals can meet those needs to form that accreditation. And as I outlined, we think that the main functions of a hub locally is to really improve access to care and to support the hospitals, to support the development of the healthcare system's capacities and competencies for rare diseases. I'll talk about what they would do at a global level in a minute. But that's our starter for 10. That's our outline ideas. What I would like to do is ask you, we've got another poll. When I describe a vision of a global hub like the Sick Kids in Toronto, do you think in your mind, does your hospital, does your expert centre spring to mind? You go, yes, the Peking University Hospital is definitely one who should be up there. If you do, please put that into the chat, and so we can capture who meets that vision. But maybe in your country, actually you say, well, that doesn't work for me. So we think that how we describe what a hub does actually is probably depends on the level of maturity of the health system for meeting the needs of rare diseases. So we have a poll here, just to, Concha, could you?
Yes, so the question is, when thinking about your disease area and country, does your local expert centers meet this vision for a rare disease hub? Is your healthcare system well organized in how they provide rare disease services? So you've got answer number 1, excellent. A highly developed system with national networks for rare disease centers. That's the one we encourage you to send us the names of the centers that come to your mind that they're doing an excellent job. Answer number 2 is a good level of national centers for some rare diseases. 3, average. Some expert centers nationally recognized as experts in the field of rare diseases. 4, minimal. So expert clinicians active internationally, but with no national recognition. And 5, basic, which is basic care. So we give you, that's a single choice. So you can mark only one of these 5 answers. So we have 53% of the participants have already voted. Somebody is asking for clarification on these questions. Would you like Matt to give some extra information about this question, please?
So I think some healthcare systems are a lot more advanced in how they support rare diseases, and the Canadian example I gave, they have a very good healthcare system. So I wanted to understand from you, does your local hospital fit that vision we've outlined? If it does, then you could highlight in the answer that you think that your health system organises care for rare diseases in a good way, and you say excellent. It could be that in your country that there's some hospitals, but they only cover 1 or 2 rare diseases, not all of them. So or that your expert centres are visible internationally, but at a national level they're not endorsed. So we want to just try and get an idea of your healthcare system and whether that vision of a hub actually meets your needs.
Matt, while we wait for all participants to answer the survey, we have a couple of questions in the chat box. Mm-hmm. One is, it's saying, I love the example, but in our country, the challenge will be which site across the country will be the hub? More than one?
It could, possibly it could be more than one. We haven't got any numbers. With the previous work I've done, I realized that sometimes size doesn't matter. The numbers don't matter. It might be that one of the key things is if you've got 2 or 3 centres, it could be that we say that they should come together and collaborate more strongly at a national level. And that could be one of the standards which we pull out to ensure that the national population needs are better met. So I think that's something which we can think about. We're going to be doing some more focus groups in June, which I'll talk about later. And will give us an idea of really how many people, how many different centres in your country, and how we shape this up, really. We don't know, is the answer. But it could be more than 1. It could be 10. It could be...
Another questions we've got is, yes, university hospitals are super great idea. However, in Mexico are neglected. I think of Hospital Juarez as Juarez de Mexico as the key hospital that might start the vision proposed. Okay, that's a suggestion. And then in the Q&A, someone is asking if this is a question for a specific condition or for all rare disease?
Well, at the moment, I said in my example that it was for the majority of those more common rare diseases, the ones which cover 98% of the population. Thalassemia, cystic fibrosis, those types of rare diseases. I think there's 390 which cover 98% of the population. So we're thinking of the global hub being one which covers the majority, and that's why I'm asking, does your hospital, you could have an expert centre which covers one rare disease in a very good way and is internationally recognised, so it doesn't meet that model, and that's what we're trying to identify.
Okay, there's another comment in the Q&A saying that there are real differences between pediatric and adult services in Australia.
Okay. We're going to capture, if we can do the results.
Okay, yes.
And we'll capture these, the feedback as well as we go along.
Okay, I finish the poll and share the results with you. So number 3, average, some expert centers nationally recognized as experts in the field of rare diseases.
So that's really great. The vision I just gave about a global hub actually wouldn't fit most places. Most of your expert centers, which you know, wouldn't fit that model. And I think that is something which we need to recognize. I want to go to the next slide because we have thought about that. We have thought that, you know, an all singing, all dancing hub, which I described, might not fit and enable everyone to participate. So we came up with an idea of an affiliated member. So I've done another example. So let's think about in the Philippines, the Institute for Human and Genetics and Newborn Screening Reference Center. They wouldn't cover that full range of rare diseases, I wouldn't think. So they would cover a proportion of those rare diseases. They might have a smaller level of expertise compared with some of the other ones. So we think that we need to have a membership which is flexible. So no matter which country you're based in, that your hospitals can participate. So we think that we need to have probably 2 types of members from a clinical perspective. We think that they all should go through an accreditation process and all should be nationally endorsed. And what they would do probably would be the same things, but I think we need to have a flexible model to ensure that we leave no one behind, because that is the vision. If you can email, if you can put in the chat your hospital, which you know, and a bit more about that, that would be great. Or email Paloma or Shiwali, and we can capture that information as we go along. Sorry, I'm terrible at names. So about patient organisations, I think this is where I'm trying to learn from my work at a European level, really, is I think patient representatives have a key and important role in a clinical network for rare diseases. We think that, so we would like patient members like yourselves to be able to be full members of a global network. We think that probably the outline ideas which we have at the moment is that the advocate organisations wishing to join should have a national or international population membership which is there, which they cover. They should be recognised in their competencies for their advocacy work. We think that the board of the organisation should endorse that hospital to take part, because it's not an individual person who's being a member, it is the organisation as a whole. And we think that because the patient organisations also have a role to play, that there should be some form of management, an assessment of the applications going in. The same with the clinicians. So what would be the role of patient advocates in a global network? Well, we all come as experts by experience, and I think when the knowledge base is quite low from the clinical side, we bring the natural history, our understanding of the lived experience, and all that can be contributed in the activities of a global network. We think that the members should also be support their patient communities to access care and have that supportive role in this, because the global network ultimately is trying to increase universal health coverage. We think you can contribute by sharing the needs of people who live with a rare disease into the discussion, into the research or guideline development at a global level, and also develop the capacity building of people in the community and promote health literacy. The important thing is being a voice and within the network, and bridging the network discussions with your community and having that interaction between the two. It's really important. Otherwise, great things can happen in isolation and no one knows about it. Then it doesn't help our ultimate aim of trying to improve universal health coverage. So the last component, so if we connect patient organizations, and we connect hospitals, whether they are the sick kids of the world or the Great Ormond Street of the world, or the Philippine Research Center. We also connect the patient organizations, then they come together in the global network. And whilst we've explained about the hospitals or the healthcare organizations at a national level, having a role and responsibility developing their national competencies in rare disease, we think that at a global level, we need to get them to do a number of things. And we would like the global activities to be structured under something called programs of care. So we think about clustering a number of rare diseases like rare respiratory conditions into a program of care, which would be time-limited activities, which could be the need, could be that for rare respiratories to do more research because of primary ciliary dyskinesia, it's such a small patient group, and you need to have global research which is undertaken. So that research activity will be agreed in terms of a program of care plan, and hospitals can join that and connect to take forward those activities. So these programs of care is an idea which we've come up with, and we want to explore. But we think on a global level, these hubs and affiliated members will be collaborating for research, education, and also providing healthcare. So the third poll, Concha.
Okay, the question for this poll is, what should be the key activities, functions of a global RD hub? That's a multiple choice, so you can select more than one answer. And the possible answers are: 1, experts offer acute advice and organization of care in patient crisis. 2, virtually present at the bedside and at home. 3, top-notch research players. 4, world-renowned training centers offering training opportunities. 5, exploit advancements in technology and innovation. 6, reduce the time it takes to diagnosis of rare diseases. 7, improve access and quality of diagnosis, care, and treatment. And 8, decrease the impact and number of rare diseases through maybe finding cures. So let's give us our participants a few moments to respond. %. We're almost there. So we have 66%. And I think we can end the poll now. And share it with you. So we have number 7 as the most selected answer, that is improve access and quality of diagnosis, care, and treatment.
Well, I mean, we asked this question because we need to, in developing the vision for the network into something concrete, we need to be able to be clear about what are the biggest needs and the biggest priorities. And improving access to quality diagnosis, care and treatment is a clear winner there. I think it doesn't matter how developed healthcare systems are, there is so many barriers there, and if that is our first and foremost priority and we lead with that foot in the development, I think then some of the other things will be automatic after. Experts offering, so the next ones was the world-renowned training centres. So that scores quite highly, which is great. I think having that capacity building and that outwardly facing view of these hubs coming together to do training, to develop competencies more broader and to share, I think is a very important one, and would help reduce the time to diagnose as well. That's fantastic. We're going to do some more, as I said, some focus groups, and we'll talk about that at the end. So we'll explore some of these in more detail, but it's really great to see that feedback.
Matt, we have a raised hand. Would you like me to go through? Yeah, so you can talk now, Ritu. Hello? I think... I think I have give you the, oh, that's it. You have unmuted yourself. Perfect.
I'm sorry, I did not mean to raise my hand. I didn't know my hand from the previous time.
Don't worry.
Okay.
Thank you.
You're welcome.
So one of the, we presented these ideas to the RDI Advocacy Committee, and one of the key things was saying, well, you know, what is the incentives for people to join? And we started to map out some of those incentives now. We think from a political perspective and from the needs, right at the poll at the beginning when we asked about the needs, it was clear that political recognition of rare diseases in your country and of your expert centres being named as being expert centres was a really important thing. So the political recognition and support, I think, is a key incentive for hospitals to join, even in countries which are where things are good. You know, increase visibility of rare diseases is always important, and to strengthen those relationships at a national level. We see that with having that external global input, the visibility from the WHO, I think would, on an international basis, would also be seen as valuable. Financial, there's probably things to be explored around funding at a national level, regional and international level, and explore those mechanisms. That's work we need to look at. We think that there should be a clear structured interface with third sector and third partners, from research, from clinical trials, from the digital sector and from IT. And so we can enable a global network in its hubs, and a wider group of stakeholders can find investment opportunities under the programs of care to collaborate and to develop things for different rare diseases. We think by having clearer recognition within your countries of expert centres, there should be an increased number of cases going to those centres because of them being recognised as experts. And that should also, by having more cases, we should see those hospitals developing increased competencies to enable greater safe and sustainable services. By seeing more people, you develop more knowledge, and that's of value to patients because it increases the outcomes of care. We think that having a national leadership function as well would be an important incentive. And putting all that to the side, there is also the value and benefits of doing international collaboration, of sharing knowledge together, of learning, creating new knowledge new evidence base, being part in research groups, collecting data on a global level, not just on a national level, and being able to access new technologies. So we think there's quite a lot of incentives around this, and we need to develop those as we go forward. So I'm going to stop there. Before I move on to the project, I wanted to see whether there was any questions, any pressing immediate questions or thoughts. Louise.
Hi, good morning. I think one of the things, can you all hear me?
Yes.
Great. From what I think an additional thing we need to maybe think about, Matt, with everything actually that's been going on in the last months in the world is the impact of virtual care. A lot of us thought that was not possible. There were all kinds of barriers to virtual care encounters, and just the experience we've had with the pandemic has made virtual care encounters have become, at least in Canada, very significant to maintain access to healthcare. And we realized that we can actually do it not for everything, but for a lot of things we can introduce what we call our virtual care encounter. So I think it's going to be really important to think about how technology can enable this global network of really the idea of bringing people together and eliminating barriers. Our definition of hub, I think we have to really get advice from that of how do we really define a hub, which could be pretty much anything, because at the end of the day, it's very much about people coming together. So that was just my comment on the virtual.
I think absolutely virtual healthcare has just all of a sudden become the norm. You know, we talk about a new norm, and that's one of them, and that is a massive step forward. Conchi, is there any questions we want to cover now? I think there was a New England paper on that recently, Louise.
Sorry, I was muted. Now I was saying that there are some comments on the chat, but I don't spot any particular questions. And I know Paloma would like to answer some of the Q&A questions, but I don't know if you want to do it now, Paloma, or maybe at the end.
Actually, ask them for them.
Okay.
No, I would like to voice the questions that have been coming in. Mm-hmm. Would now be a good time, Matt? Or would you like to go into the specifics of the project?
Any pressing ones, and then
well, before we move forward, because I think that third part will really go into details, and the questions that we've been receiving are quite broad, and I think they're in most people's minds. One of them is regarding the transition from pediatric to adult care. This is something that most of our participants think it's very important to keep in mind, because in many countries, the centers of expertise are based in children's hospitals, and we should not forget, of course, adults with rare diseases. So how would the global network deal with that?
So I think when I gave the example of a hub, I said about the assessment of that a potential hub into a global network, and we have some standards which we can outline, one of which is around care coordination, and very much care coordination from pediatric to adults would be a perfect way, because we don't want a cliff. We don't want to say, oh, you're great in your own silo as a hospital. We want to know you're great as a hospital within a health system. And I think very much it could be that we put in as a requirement or a standard that hospitals need to cover the life cycle, the whole life journey of people from birth to older age. So, and how they do that and how they demonstrate that would push and incentivize them to either come as put in an application for a hub, which could be a multi-center application between a pediatric and a number of adult centers together. But absolutely, it's a critical thing, and it's good to hear that, because it helps us take that coordination of care and expand it into something which is more meaningful. I don't know, Louise, you were nodding whether you wanted to say anything.
Oops. No, I completely agree with you. And coming from an adult center, academic center, and having lived the transfer of patients with cystic fibrosis, with blood disease, metabolic disease, this is something that's very important to think about, because we're talking about care continuums and care pathways, and the importance of actually eliminating those walls or that fragmentation that exists, and recognizing that the experience of patients with lived experience, that whole transition from a pediatric age to an adult age going through youth is extremely important to think of, because it has to be part of the accountability of preventing fragmentation in that continuum of care.
Yes, I have another set of comments and questions that I think we should address now, which is the regional differences and the language barriers that of course have to be encountered in any project of this kind, global project. And the inequalities amongst regions, because of course Migdalia from Pulmonary Hypertension Latin Society was pointing out to the big differences in Latin America. For example, Brazil, Argentina are countries that have many centers that could be recognized potentially or accredited, but other countries, as we know in Latin America, don't even have one, right? So how to reconcile all that? I mean, the simple answer is that that's why we're doing this, right?
So I think there's huge variation in health inequalities around the world, and we're trying to resolve some of that. That's one of our central things. We want to ensure we're inclusive, and we have a model, like I said, about a flexible model around a hub, to put a vision out there and saying this is what we want, but enable countries and hospitals or health organizations which don't meet up to that know that that's an aspiration, and so they can come and enjoy and see that that's a thing that they develop into, and develop some of those standards which we set out. So I think having different types of membership is important, to be able to say, well, this is where we want people to go and develop. And it could be that your hospital has an expert who's recognized, but your hospital isn't recognized as a rare disease hub. But by joining and taking part in, we'll start to put them on a development path to move forward and to reduce some of those inequalities. I think with language, language is the biggest barrier around. I know I live in Germany. I struggle with that all the time. I think we have to think about that in a lot of detail, how different regions collaborate currently under the WHO and what others. I'll explain in a minute the project in more detail, and that we're going to look at how other networks on a global level or on a regional level operate, and we'll find out some of those, how others do it. So we'll learn from people's experiences.
Okay, thanks, Matt. And another set of questions is regarding the hubs. How to select the hub, which one? Which one will be the hub, and also are patient groups eligible? Will they be able to potentially be leads and create regional hubs themselves? So patient groups.
I think it's a really good idea. I think I want to explain about the project, I think, because the part of the project is saying how we go about on that process, if that's okay. But let's capture the bit about patient organizations being part of a hub. And that's something which we can look at as we go forward. If it's okay, just because of time, Paloma will carry on, and then we'll.
Yeah, let's go ahead.
So, in terms of the project, the WHO, as Jan said, and RDI have a memorandum of understanding, and we will be. There's 2 deliverables in that for this year. We're working on this one, which is the global network. HSO and RDI are collaborating together to take forward that memorandum, that expectation, and turn it into a reality. and I'll talk a bit about that in a minute. What we'll do is we'll produce a technical proposal, which, as Jan outlined, will be the basis for the needs assessment study. And so we'll work on that this year, and we will have an expert advisory board of people to contribute to the work which we're doing over the next 2 years. Now, RDI, come November this year, will hand over the needs assessment study to the WHO to fulfill that cycle. I mentioned about an external advisory committee board. We put here that we think that the board should be engaged. We think about 16 members, people from the WHO regions, experts in accreditation, people from the project team, people from the RDI advocacy committee, and we've already had a very positive feedback of people who would like to join this from the advocacy committee, from the Global Commission, from regional and national authorities, and from professional societies. So we'll form this external advisory board in the coming months, and they will oversee the project and to ensure that what we develop in terms of a population needs assessment study and a conceptual model for the global network is something which meets the needs of the community. The project will be over a 5-year period. We're in this stage doing the needs assessment study, the discovery phase, finding out the what. Next year will be the development phase, which will turn what we describe here and will articulate how that global network is established. So we'll describe the methodological framework. In 2022, we'll actually do the assessment. We'll do an application round for people to join, and we'll do the assessments to do a pilot in 2023. And then after that, we'll look at reviewing the pilot and seeing how we can improve things and move it to a sustainable phase. So the question really about how we, what we do in terms of the population needs study, the project will take a top-down approach by looking at what is currently in existence now, current networking which is happening around the globe, around your region or in your country, to learn from those networks about what works well, what doesn't. Identify the key characteristics, structure and services available in those different networks, existing networks, to then pull that out and say, well, this works well, and the learning from that, engaging with existing networks will help shape how we describe and how we design what a global network would look like. So we'll come up with a concept model which will describe what the network does, how what services it provides, what added value it will provide, what's its success values, and we'll also design that based on patient needs, and we'll talk a bit more about that in a minute, and also based on public literature. So the concept model is the what. What is a global network and what do the members do? We'll do next year a bottom-up approach, and we'll look at, from your hospital's perspective, from your health organisation's perspective, we'll see about what services are provided, what are the competencies of those centres to meet the needs of your community. And we will come up with a way of mapping those competencies, and then irrespective of the countries which those hubs come from, to design a framework, an assessment framework. We've called it here a methodological framework because that's what it's called in the MOU. But the methodological framework will describe how a global network is established. How do people apply to join? The standards which they need to meet in order to join. So that will be the next piece of work next year. In between the two, both of these is around patient needs, and I've got a bit more detail on how we'll use the needs of people with a rare disease to be able to assess a hospital whether they are a competent centre and should join a global network in a minute. So this year we'll have 3 tasks. We'll do a survey of patient needs. We'll do a semi-structured interviews of existing networks to learn from what works well now and gain insights from them. And we'll do a literature review on the added value of networking to identify the key characteristics and function of something which is useful and has an evidence base. They will go into this population needs study, the outcome of this, the learning, the insights, and the findings will form the population needs study, and we'll summarize that evidence, and we'll then design what the networks will do and give an outline of the structure of how it should be set up. I'll talk about the survey in a minute, a bit more detail in a minute. Next year, we're going to do a mapping exercise engaging with the national alliances and international federations to identify who the potential hubs are, to try and to see who globally are the ones we should be engaging with. We're going to do an on-site visit to 3 hospitals in each of the WHO regions to identify the core competencies of those hospitals, because it will be a bit apples and pears, how each hospital system will be different and how they are structured. But we want to be able to see what the competencies, what's the commonality between those hospitals in meeting the needs of rare diseases in those countries, and to come up with a baseline competency assessment next year. We'll do an exhaustive review of existing assessment programs and best practice out there to develop the assessment model. And that will come into very concrete eligibility criteria, application forms, etc. next year. I did this slide the other day, and I think it's just really answers, Paloma, the question you asked about how we select. We very much need to put on, and Louise is a great advocate. She really steers me in the right way. We need to look at hospitals through the lens of people living with a rare disease, the lived experience. You know, we want to be able to see that the hospitals and the hubs which go forward and are selected meet the holistic needs of people. So we're going to do this year a survey of patient needs. We want to identify some what we call reference cases. So a reference case of a rare disease which represents a bigger rare diseases which are similar in different ways. So an example would be for Duchenne could be identified as a reference case for something which is more neuromuscular and movement related diseases. And so we could then collaborate with an international federation and do a survey of those members of their needs in the different around the world. We could do that. There's a number of ways we can cluster rare diseases, and we're doing a piece of work at the moment which is trying to map out what are the different ways we can cluster rare diseases, which can go forward to maybe shape how a global network is structured in the programs of care activities which I described earlier. As I said, you know, this is just an example, and it could easily be thalassemia is identified as a reference case, etc. But we'll be engaging with the RDI Advocacy Committee on our clustering proposal and get advice from the committee on the reference cases. Once we've done that survey and we have identified the needs of people around the world for those different reference cases, we're going to develop something called a balanced scorecard. And that will be a way we could use that scorecard when we do the visits next year to be able to look and say, is this hospital meeting these needs? So we will be looking at the hospital based on your needs to say, well, how do you meet those multi-system holistic needs of those conditions, and to be able to map the different competencies of those hospitals, irrespective of their healthcare structure. And so once we've done that baseline competency mapping, we'll be able then to define the standards which will be used in assessment of applications. So an example here could be the Peking University Hospital is assessed to join the global network using the balanced scorecard. The hospital needs to demonstrate how it coordinates care to meet those holistic needs, and how it can demonstrate being a national lighthouse of expertise for a national population. So describing that and learning from that will be from you and your community's starting point. So I've got one last poll. Concha, I think it's the last poll.
Okay, the question for this poll is, what do you consider being the WHO Global Network and its RD Hub members' biggest impact for your disease in your country? And the possible answers are: help to structure the healthcare system in your country, to support the development of an official recognition of rare disease, 3, support the development of an expert center for rare diseases, 4, identify where the experts are in your country, 5, support access to expertise and reduce the cost of care, 6, enable advice for care to local centers, 7, enable access to treatment, and 8, support clinical research activities, and I think there's a 9 hiding, yes, and 9, enable access to innovation. So the question is ready for you, sorry, the poll is ready for you to answer. This time is a single choice question, so you just need to highlight one. We have 60% of the participants that already have voted, and let me give them a few more seconds. It's getting interesting. Okay, I think that's us. So I'm gonna end the poll. Oh no, there's still votes coming in. 82%, so I think, yeah, I think this is it. Okay, so let me share the results with you. So option 3 is the one most voted, support the development of an expert center for rare diseases.
Okay, I think that's really interesting. Those these answers about what you think the biggest benefit will be for you, the biggest impact. If we go back to the first poll, I asked what were the biggest needs, and I'm curious how they align up. So you said about having recognition in your country for the rare diseases, and also around saying about knowing where the experts are, and that you're getting your expert centers being recognized. So there's clear alignment there. So it really helps us to color this, to turn these sort of top line thinking and just try and put some meat on that, turn it into something which is meaningful for you, and support access to expertise, reduce costs. So we heard earlier that the biggest impact as well was around improving access to diagnosis, care and treatment. Louise mentioned about virtual care. Maybe that reduces costs as well and increases access. It's really interesting. So thank you for that. Research has scored lower, Louise, than I had originally thought, actually, in both of them. So that's interesting. Okay. Before we come to questions, we'll just do the next steps, if that's okay, and then we have the questions for the rest of the time.
Okay, cool. That's fine. I think this is the most exciting part, at least for Paloma and I, because this is how the RDI members can get involved, and hopefully we can facilitate your engagement. So there are numerous opportunities to be involved over the coming year. So we've scheduled 3 webinars, which includes this one right here, but as well as a webinar in August and October, as well as a set of focus group calls in June, organized for each of the WHO regions. Today's meeting serves as a kind of introduction to the concept of the global network, but when we get into the focus groups, hopefully they'll be more targeted, and you can express your particular needs and the needs of your region or your country. And as well, we can start to flesh out the core concepts of the global network in more detail. The second and third webinars, which will be in this kind of format, will present the findings of the needs assessment survey, as well as the literature review and interviews done with other stakeholders along the way. We'll also start to present an outline of the concept model for the global network based on the findings, but also it's an opportunity to get more input and feedback from our members, but also just from patient organizations in general. In 2000, so this year is very strange, to be honest. So in 2020, we'll be engaging our members in surveys on patient needs in the selected reference cases, but as well as engaging our members in patient organizations when we conduct interviews in existing networks. We are planning on identifying 10 existing networks through which to engage stakeholders. And the following year, in 2021, we hope to conduct site visits and have a number of national alliances take part in these site visits to also see what their potential rare disease hubs could be and which ones they would have in mind. Yeah, so if you have any questions about how you can engage or how RDI can help you engage at the level you want to, it would be really nice to contact Paloma or I on that. Thanks, Matt.
So I think the interviews one is really interesting. So I know we'll identify 10 existing networks like ERDIC, that's a global network. We'll get a patient representative who's involved in ERDIC, a clinician or a researcher, and someone from you know, a national or institute. And we'll triangulate, we'll find out the views of them around the value of ERDIC, what are the characteristics, what's the model, and so we'll triangulate the views from the different stakeholder perspectives to come up with some concrete insights, and we'll do that for different networks. So we'll be engaging with the patient representatives in that. Thank you very much. Paloma, I don't know whether you want to do questions now and cover those. We've got one hand up.
One hand up? I don't see it.
No, okay. That's,
Concha,
Sheila,
can you help us with that? Sheila, would you like to ask your question?
Hi, can you hear me?
Yes.
Okay, hello everybody. So this is absolutely fascinating. As a global organization that we are, I see that the major benefit would be through us to then reach out to our member organizations, which is why I keep asking about languages. And in fact, this year we were supposed to have our flagship event in Latin America, and then life got in the way. Yeah, I think this is very important for all global organizations, because that's where you can get the maximum benefit rather than reaching out to individual. I'm not saying that you have to leave them out, but with one global organization, you have access to all four corners of the world. So I'm jumping ahead of my board, but I think we would be really interested to do that. So take note, and then I will get back to you after I speak to my board. And if there's any supporting documentation that you can send me, like the poll questions that can then be translated, especially in Spanish, and then we can share it on to our Latin American region, that will give us a step ahead.
Yeah.
And that's it. That's all. I'm super enthusiastic about this, but yeah, I'll keep it simple.
Super. We're all really excited about this as well, and it's great to hear that from you as well, that it's hitting a chord, it's resonating. I feel like, as I said right at the beginning about the questions, is lots of questions about what this is, how is it how can this be valuable for me in my country, for my rare disease, and we really need you to collaborate with you to really articulate this better, to articulate this, that it meets the needs for people you represent, for your communities. And I come as from a very westernized British, in fact, perspective, and I try my best to take those glasses off a bit, and really this is about you saying, and me and Louise supporting you to articulate what good would look like, what would be success.
Yeah, one more thing before I leave you. We are doing a mapping of our own right now to find out what drugs are accessible in what countries, and that's through our member organizations. So when you said the mapping word, I said, yay, another mapping project. That's why languages are so important, because if we can't communicate with the right language, the member organizations will not participate because they have lack of understanding.
Super, thank you.
Yes, absolutely. With Spanish, we can help. We cannot translate in every language, but with Spanish, we can help, and we will. I was saying in the chat, Matt, that I will try to translate the slides and the polls and the questionnaire that we will be sending afterwards into Spanish only.
Okay, thank you. That'd be fantastic. That'd be one less work for us.
Thank you, Sheila.
Thank you, Sheila.
Concha?
Yes, we do have another question from Anthony, so I'm gonna allow him to unmute himself.
Hi,
thank you.
Tony. I represent the International Prader-Willi Syndrome Organization, and this is very exciting development, and I know we'd be very keen to be part of this, but I want to raise two concerns and ask for your comments about it. One is people with Prader-Willi syndrome, like many people with rare disorders, so this is a neurodevelopmental disorder. The issues go beyond the purely physical and also include the behavioral and the mental health. And those are areas that are all too often left out in any developing healthcare system. And I would ask that you don't forget that aspect. And the other thing that I suppose I express some concern about is too much emphasis on hospitals. We should be talking about healthcare systems and health and social care systems, because many people with rare disorders, it isn't simply about a diagnosis. Well, that of course is critical, and treating the comorbidities is important, but it's also about care, and particularly when it comes to adults. Thank you.
That's really helpful, Anthony. I worked 10 years in mental health service in the UK, so it's very dear to my heart, really. And I definitely don't want to neglect it any more than it has and does get neglected. We will, when we come up with the clustering proposal to identify some reference cases, we want to look at some of the stuff around the WHO. Louise, it was the stuff around function, disability and health, the WHO framework, and that includes in there very clearly about mental health, mental well-being, and emotional well-being as one of the functional things to capture.
Yeah, as well as Matt, we talked about also the intellectual disabilities.
Yeah.
I completely agree with Anthony. If we start looking at this through continuums of care, where regrettably there are some diseases that actually don't have specific treatments, and even those that do have treatments, the impact holistically to patients, their families, and the community is very broad. So, and I think when we go back to our academic centers, we have a tendency to look at it very much as a diagnosis. And one of the things I think we want to do with this global network is to bring it again through the lens of the patients, which is above and beyond the diagnosis and the treatment.
Louise is very much the guiding star, my North Star, when it comes to these things. It's great. Thanks, Louise.
We do have another raise hands. Let me allow to talk. Hatiya, you can unmute yourself now.
Okay.
Thank you.
This is 10 p.m. in Malaysia. I just want to raise this question, whether it's my own observation or it is common throughout the world. Because I don't see, you are talking about expertise from all angles, but I don't see here from my experience and the geneticist and the pediatrician working together. Because I see some situation where pediatricians do not have that respect, or I mean, regards to geneticists. Because there's one statement where I asked, why is your team not including the geneticists? The answer was, oh, they are not important. We are the one who treat. So if that is the attitude of our pediatrician, then this is not going to help us. You know, in our country we have genetic clinic and we have pediatrician, institute pediatrician, but not many of them will work together, and not many, there is no coexistence. It is so difficult for us to work. There's no, who do we go to the geneticist? They only know, they have their patient geneticist, and there is no a body, a council where we as patient group can go and meet up. So because they are God, we have, our patient have to listen to them. That is our issue, or my issue at what we have experiencing. Because some of the patients will say, I only see my, I don't see geneticist. We don't know there is things, I mean, person like geneticist. And then we have, was this patient having to go from different specialists. So like in my society, I have about 200 over patients, and we have about 80 types of disorders. So these are things that we get information from them. You know, we have the, if it is a skin clinic, it's just the skin only. So they don't get referred back. You know, so is it my observation or no, or it is also common in other countries?
I think when we do the regional focus groups, we'll explore some of those things in terms of the collaboration and the work, continuity of working between, coordination of care between the geneticists and the pediatricians. We can explore that. And I know I'm surrounded by geneticists and pediatricians working together at the moment. So I think different countries and different regions will have different needs, but I think we can, I think one of the key things which we believe is that that coordination of care between the different disciplines is really essential, and it's something which is neglected. So you have lots of specialisms, in lots of experts in one specialism, but they don't collaborate outside their department. And we want to square that circle, as it were. We want to move it forward.
And the other issue is we have hospitals under the Ministry of Health and hospital under the Ministry of Education. University Hospital is under Ministry of Education, and both these universities are in Kuala Lumpur. And all patients throughout the country must come down to Kuala Lumpur for treatment. So for those that are in the government hospital, they are almost negligible payment because free, except for the enzyme and all that. Otherwise, you know, like Mafan, they have heart problem, they can have the drugs is available in the blue book, so you can get it at no cost. But if it's not in the blue book, then that is something that is controlled. But whereas a patient in the university hospital, they are considered as semi-government, and they have to pay for their expenses, for the drugs and boarding and all that. So there is that sort of arrangement because of Ministry of Education. The budget is for education, not for treatment. But we always say that they should have enough patient and enough funding in the Ministry of Education or university, because that's where we are training our doctors. We want to have genetic counselors. It's not available, not possible yet, because there is no provision in the job list. So, you know, it's something that it will take a whole, I mean, lifeline time to get a job recognized to be included in the services. Because we have proposed to them that we want more genetic counselors, because geneticists are so little. For the whole country, we have only 10 geneticists in our country, but they are good. They are good and hardworking, but you know, that is all our shortcoming. I hope you all will visit us in Malaysia. We have a WHO here, but I think unfortunately WHO here is not in the interest. They don't have the interest of the rare disease, but they go for disabled and for children. Rare disease itself is not an issue to most of the to WHO here, but they go for children. If we want to participate in their program, it should be disability or those other things, but not on rare disease. Okay, that is my comment. Looking forward to your trip here. We have good geneticists and good teamwork professionals here.
Thank you.
Thank you very much.
Thank you for the nice invitation.
We do have another raised hand. Let me, okay. Kawaldip, you can unmute yourself already. Thank you.
Okay, thank you very much. I think what we heard from Malaysia really exemplifies what the RDI needs to do. It's an objective you may have to set with this project, that we have to dismantle the silos that have been set up and even reform the reimbursement and the big politics of professional rivalry within countries. As we heard, the doctors may not like to see the pediatricians come into something, and the pediatrician doesn't like the genetics, and the genetic counselor who's really working their butts off sometimes are not included. And then lastly, the nurse, the specialist nurses I've seen here at Whittington Hospital, where they deal with thalassemia patients. Emma Prescott, I always clap for her. She really advocates heavily on patient issues and trying to get patients into the debate. So doctors even don't include patients. So basically the patient perspective is not included. So it's not only silos which are putting professionals out, the silos are also pushing patients out. So we need to do that and bring them back in the center. That we don't have a collaboration that becomes technical and entirely professional based and very little, as you said, holistic approach to everything. Thank you.
Thank you. I think we absolutely want to look at this from a holistic perspective, and actually Louise is a great one for trying to redraw some of these boundaries and how we describe this and how we set it up, what's important. So I think they're very good comments and well made, especially, you know, the specialist nurses' involvement, and that it's not just this, you know, professor such and such. It's truly multidisciplinary. At the heart of this is absolutely essential. I completely agree. I think it's going to be a challenge, but we can think quite smart about it. And I think, Louise, you've had some ideas about that before when we talked about what Hub does, and is this a network of coordinators, you know, really, rather than you know, just the experts.
Yeah, if I might add, thank you so much for all your comments. I am drawing as I actively listen, and fragmentation, barriers, professional rivalry, I find that disheartening to hear, but I know it exists. And this is where maybe we can be bold and courageous and really have that voice of not attacking that, but asking very smart people, why can we not change? Why can't we make this a more fluid, a more intercollaborative, coordinated, integrated way of working, which will be actually win-win for everybody. So instead of competing, why don't we collaborate? and just to bring out that message and ask people in a reflective way, how are you doing that? Could actually bring phenomenal change, I think. I've had experience with stroke patients, and that's how we went about it, saying, well, are you listening to people with lived experience of stroke? And by listening, actively listening, you actually bring reflective practice and changes in how you do things.
Concha, I'm aware of time. We said that we've gone over a bit, which is really bad. I'm sorry, I probably took too long.
No, but one thing we could do is to, if there are answers, if there are questions we haven't had the occasion to answer in the Q&A, we can do so after the webinar, because they are going to be in there.
Okay.
If that's okay, or if you prefer, we can go on.
I'm just conscious of everyone's time. I feel it's bad form to run over too much. Paloma, if there's any last three questions you want to pull out, and then we'll close the webinar and we'll follow up with anything which is outstanding by email.
Okay, well, from the Q&A, I'm seeing a lot of comments more than questions. This idea of dismantling silos, which we already have covered, which is very important, if we know we're in the rare disease field. Kawaldip is saying expert patients are really their weight in gold in the rare disease landscape. Expert patients is true. They are a critical part of this project. And I have a question that I think is in everyone's mind, but maybe no one kind of dares ask, or you haven't thought about it because it's coming further down the line, but it's very, very important, which is the funding. How, once accredited, how will these centers be funded? I think it's something that we need to ask ourselves.
I completely agree. I think I highlighted some aspects around incentives earlier. We need to develop that thinking quite clearly and explore what are the international and the different types of funding structures out there to enable this to happen. I think with any type of funding, it would always be a multiple model. Trying to create opportunities for grants and project funding, but also there would be voluntary collaboration, cooperation, which would be supported by the centres themselves, and that's what part of what they would sign up to do, to be able to also do some of the other work in terms of international projects, which we would look to develop. I talked a bit about a main interface with third sector, with IT, with genetics, with industry, pharma, as a way to funnel and put up. In my head, when I go to my supermarket, there's a notice board of different things you can pick up and say that's interesting. So a place to be able to engage as the structure engagement with of the global network with third parties to ensure that we get the funding into the network to take forward the programs of care.
Yes, and I think another question is about how do we plan member states to be involved? How to involve governments, and how can patient groups help?
I think, well, when we develop and we submit to the WHO the concept model and the methodological framework, and it's seen that there is political recognition which is needed in terms of endorsement of hospitals into the national health systems, that will be a really important step to involve member state countries. We want to have on the external advisory committee member state representative from the different UN countries. I wouldn't see it being a huge representation, but we want to make sure that voice is there to be able to steer the project from the member states' perspective. Probably one of the key things in terms of engagement with member states as well will be around the interviews, looking at the existing networks, of which are out there and who we interview there. But also when we do the visits next year, it would be great maybe to engage with the member state as well as the National Patient Organisation at that point in time as well. We did visits similar a few years ago, and there was very much political representation there as well, which I think is also important. Those visits are very much warming up the wider community's knowledge ahead of doing an actual assessment of applications the following year. So we want to be engaging the potential hubs next year to get their awareness to be built ahead of doing a call for application the following year. So absolutely.
Okay, do we have any other raised hands? I think we should come to a close now.
No more raised hands.
Okay, well, we're 10 minutes past, so
sorry
I think
about
it's time. That's okay. That only proves that it was very interesting, and that we had 36 participants at one point. Some in Asia, actually, like Hatice was saying, at 10 o'clock at night. So that just demonstrates how interested they are in this. Thank you all for participating. Thank you, Matt. Thank you to all our panelists. And thank you all patient representatives of the RDI network for coming to this webinar today. I hear very loud and clear your message that this has to be tailored to your own needs in your own countries. Of course, as far as the practical issues, language barriers are always a problem. We will try to overcome those together. We at RDI don't have the capacity, obviously, to do all that by ourselves, but we can rely on our national alliances and international federations and national chapters of our international federations to translate all this material. We will do what we can. We can translate we will be sending you a short survey next week about this that we can forward to your own members, and we will translate it into Spanish. I cannot say anything more about the other languages for the time being. Thank you very much for coming. As you will see in that video message from Rudiger Kretsch that we could not hear, unfortunately, at the beginning of the webinar, this global network of rare disease expertise and the development of such a network would indeed be a very big step forward for the rare disease community. So please help us make it a reality, and stay tuned for our next webinars, which will be more regional. We will organize 6 regional webinars at the end of May, last week of May, beginning the first week of June. Thank you all. Keep safe and well. Bye-bye.
Okay, bye-bye.
Thank you, everyone. Bye.